It'd be better not.
Okay.
Do you want?
What I tell patients is you get one chance to squeeze a pimple.
Oh, okay.
So make it a good one.
Oh.
So if you have something that's rather superficial, take a warm washcloth, try to get it to the surface, and then you get one chance. But the problem is if you keep going after it and not just the squeezing, but the gouging, the digging, the multiple repeating, it starts to heal, you go after it again. That constant trauma just doesn't allow it to heal, and you're more likely to get a scar that results instead of the short-term benefit of trying to make it look less noticeable. You're going to get the long-term disfigurement.
Right. Well,
And it increases the chances of injecting more of the superficial bacteria in the skin into an open lesion as well.
oh, sure.
The skin barrier is inflamed and breached, and bacteria can easily get in. So,
I mean, the body is an amazing tool. People are so aware of what their face, that type of thing. So I guess that's a good rule of thumb to go by. Yeah, let it just naturally do that. What other treatments do you have at Advanced Dermatology to talk about either rosacea or acne?
I think a lot of it is education.
Okay.
And as you mentioned earlier, people may, if you don't understand the process, and it takes a month to go from the bottom of the skin to the top to turn over, it takes a minimum of a month to know if some treatment regimen is going to work.
Okay.
So education, I think, is very valuable in addition to all the tools we have to let people know they have to give something a try, and they may have to let their skin get used to something.
Sure.
It may take anywhere from a month to 2 months to know if it's going to be helpful. And if they've noticed some benefit, it's not something they can stop. They need to continue, because once they stop, because they look good, it's going to come back. Because we haven't changed their skin. We haven't changed the oil production. We haven't changed their DNA. We haven't changed a lot of their factors. We hopefully give them education about stopping to touch their face. Try to be a little bit more relaxed. Try to avoid for rosacea if there's some flare factors they have found. But trying to educate them to how to deal with their skin.
I think that's really important. We do spend a lot of time trying to educate people on how to take care of their skin. A lot of the common acne medicines, if you use them the way they were originally FDA approved, are very, very irritating, and most people just can't tolerate that.
Okay.
So we've developed our own special regime for using those, and it's really worth the time to spend that time with patients to teach them how to apply these medicines and use them in the most beneficial way, so they get all the benefits from it and not all the terrible negative side effects.
Sure. A little bit more knowledge.
Exactly, yeah.
Another treatment option that we will occasionally use for people for those emergency dermatology visits, a big blemish, and they have a big event, a wedding, a prom. Steroid injections sometimes can be of some benefit, knocking out the inflammation rather quickly. And then you also get the symptomatic cysts that are it's not just an aesthetic problem, but as symptomatic functional issue, something that's very painful and swollen, and that can be injected with the steroid. And sometimes we do more surgical approaches too, where you can actually lance, open up the blemish to allow all the material that's underneath, similar to a splinter, allowing the material that's underneath to come to the surface.
A little more refined version of what your mom was doing.
Yes.
But the same concept, actually.
Exactly. And some cysts that are quite large, that are present for a long period of time, don't require antibiotics or topical medications. They're not going to be of some benefit because they're so deep. Those actually would need to be surgically excised.
Okay.
And they're done under local anesthetic, and that can work quite nicely for those more dramatic lesions.
Okay, and that can be done right at your clinic then, Advanced
Absolutely.
Dermatology. Great. Okay. That's good to know. So I also wanted to talk about, once someone does maybe get a lot of their blemishes gone, we want to kind of talk about, continuous care, that type of thing, along with cosmetic use too. And we can touch on that, about what kind of cosmetic can be used for, people with acne. That'd be really good.
The first thing I tell patients is to look for over-the-counter products that say non-comedogenic.
Okay.
And that's true for sunscreens as well. Some of the acne medicines that we give people do make people more sensitive to the sun, and it's important for them to protect their skin during that time.
Okay.
So look for things that say non-comedogenic, and that means it's less likely to break out from the products. It's not a guarantee.
Right.
Personally, I break out a lot of non-comedogenic products myself, but you just have to try certain ones and see what works for you. We have found over the years, we all know in the dermatologist world, we know that mineral makeups are much less comedogenic. And so looking for high-end mineral makeups are really worth it if you're going to be putting foundation and blushes and things on your face. You don't want to be doing that and having it cause acne.
Right.
You have to be a little careful, though, because some of the makeups in department stores, if they have 8% or more mineral in it, then they can call themselves a mineral makeup.
Oh.
And that's not really what is included in the research showing that mineral makeup is better for your skin. So you're really better off getting like Glow or Jane Irondale, those kind of mineral makeups
Okay.
products.
Yeah. Well, you know, it's supposed to be FDA approved, you know, all those. And then we're talking about toxics in some of the lipsticks, you know, that we're putting into our bodies.
Yeah.
And, you know, here we all have this idea that, oh, well, FDA is approved, so it shouldn't have lead in it. And then we're coming to find out, yes, some of the lipsticks do have lead.
Yeah.
And,
Kind of scary, isn't it?
it is very
You have to be
scary.
really vigilant about what you're using.
Well, I have a blind faith. I, you know, was FDA. I thought they were out to protect us all. And now we all have to do a little bit more homework and kind of...
Yeah, that's another whole topic.
Yeah, we'll have to have you back for that one. That'd be great, yeah. I'm glad that we brought up rosacea also, you know, a part of acne too. Can we get a little bit more of a description of rosacea for our viewers?
Sure.
Okay.
A lot of times rosacea begins initially as a flush. And I have a lot of people that will come into the office and they'll say, do I have rosacea? Well, if somebody has a little bit of redness on their face, they never break out, it could be a fair-skinned person. And some people just have a tendency to have blood vessels. And so just the fact that you have blood vessels on your face doesn't mean you have rosacea. Doesn't mean you couldn't eventually have rosacea, because it's not uncommon that the fair-skinned individual will have rosacea at some point in their life. But a lot of times it's a combination of flushing, redness, breaking out with some red acne sort of lesions. As a rule, they don't have blackheads and whiteheads. Some people will have both, so they may have a combination of acne and rosacea. And then typically that can worsen over time if it's not treated, if a person doesn't pay attention to those flare factors. And then at some point, particularly for men, the nose can get a little bit fuller, thicker, and then when it gets to that point, it's difficult to reverse that condition. So they can have a combination of redness, breakouts, and it's very typically center of the face, kind of the center of the forehead, the nose, the cheeks, kind of the center of the chin. So it's a little bit different distribution than kids where or adults that have the more typical acne, where they can have it pretty much anywhere, and more commonly on their chest and back as well, while rosacea can occasionally occur those areas, but it's not as common to occur those areas.
Okay.
Rosacea I always think of as more of an inflammatory condition.
Okay.
And those inflammatory papules are centered more in the central part of the face as well.
Wow.
And that leads to, the more that the inflammatory condition persists, the more likely that it'll worsen over time. So rosacea is a condition that it's actually really important to get it under control and keep it under control. Unlike regular acne, which will kind of, for most people, peak during adolescence and then become more quiescent. Rosacea will continue as long as these inflammatory lesions and inflammatory blood vessels persist. It just becomes more and more of a vicious cycle with more damage occurring.
Sure, so we have to nip this one right away. Well, so we're talking about this. What if you don't catch it in time? Is there a cure?
No, there isn't a cure. You know, like many things that we have in medicine, like diabetes and high blood pressure, we don't have a cure for those.
Okay.
People are working on those, but we don't have it yet. But we do have good medical management, and we can keep it under control so that it's not a problem.
Yeah.